Hi, beautiful people. How are ya? I hope you're having a great day. So, how are y'all doing? I hope you're all well. I went for a ride with family to Indianapolis to watch our oldest granddaughter compete in a state archery competition. She didn't place, but she did win a $500 college scholarship, which was wonderful. That'll cover all of her entrance fees into college. God provides, doesn't he? And I enjoyed all of the laughter and conversation that I had with family on the drive up there and home. I feel blessed. Sometimes I just need to get out of the house. My husband didn't go, but he drove me to meet our daughter and son-in-law and his mom and his dad. And on the way, I said to my hubby that we were overdue for a date night. He agreed. And so I guess we'll be having a date night here soon. Fun, fun. Today's video is about the neuropathic fibromyalgia pain called headaches. And I'm sure every one of us have experienced a headache from one point in time to another. And I also talk about migraines in fibromyalgia and cluster headaches and tension headaches. So here we go. These are the 8 types of fibromyalgia pain according to Very Well Health. They are How many of you get headaches? I'm sure all of you. How many of you have had a migraine? Did you have to take a trip to the emergency room to get that migraine under control? Probably most of us have. It's a common report of people experiencing migraines. Is it because we didn't have preventative care through our doctor? That wasn't my case. Or did a migraine still burst through our medication? And that was my case. And because of that, I ended up having to switch around or add medications. My hope is that all of you can get the right treatment you need for your migraines and headaches if you're experiencing them. I don't get migraines anymore. My migraines were a hormonal issue as I was entering perimenopause, and they stopped once I hit menopause. I get headaches from time to time, especially if I haven't eaten anything or I didn't get enough sleep, or from sitting here and causing my neck to tense up. It'll tend to work its way up into a headache if I don't get my posture under control. But I know that these are common types of headaches, right? What do you experience? I'm not going to pretend that I'm an expert on the subject, so please work with your doctor. But in people with fibromyalgia, it's common to have chronic headaches that interfere with daily life. It's common for us to have migraines or hormone headaches, which are often on one side of the face. It's common to have cluster headaches, which are around our eyes and face. It's common to have tension headaches on the forehead and our head area, and sinus headaches, which are generally around our eyes and our nasal cavities. So I want to cover these briefly starting with the terminology chronic headaches. According to Mayo Clinic and the International Headache Society, a chronic daily headache occurs 15 days or more a month for longer than 3 months. Cephalgia is the medical term for any type of pain affecting the head, face, or neck. According to the World Health Organization, headache disorders ranked third highest cause of overall neurological disease disability in 2019 after stroke and dementia, and that's between the age of 5 and 80. Headache has been underestimated, underrecognized, and undertreated throughout the world. About 40% of the population, or 3.1 billion people in 2021, were affected by headache disorders. It's more common in females compared to males, and headaches are a worldwide problem affecting all races, income levels, and geographical areas. The long-term effort of coping with a chronic headache disorder may also predispose the individual to other illnesses. For example, anxiety and depression are significantly more common in people who experience migraines than in healthy individuals. Have any of you experienced chronic headaches prior to fibromyalgia? What about after fibromyalgia? Worldwide, only a minority of people with headache disorders are appropriately diagnosed and treated by a healthcare provider. That surprised me. Is this because people will downgrade their experience and not seek appropriate healthcare treatment? I know that when I got migraines during my first pregnancy, I didn't tell a soul. I didn't even tell my doctor. So maybe that's it. I assumed that it was an embarrassing symptom and I shouldn't talk about it. I am not like that today, let me tell you, because headaches are not just painful, they are disabling. There are primary and secondary headaches, with primary acute headaches being the most common. Let's start with primary headache. A primary headache is painful but not dangerous. It has no relationship to an underlying disease or structural abnormality, so it's an independent health condition. About 90% of all headaches are primary. The pain comes from inflammation of the nerves, blood vessels, and muscles surrounding the head, face, and neck. Stress, nutrition, alcohol, changes in sleep habits, and other factors are triggers. Of the types of primary headaches, tension headaches and migraines are the most common. Tension headaches are the most common type of headache. Half of all patients who report headaches have symptoms consistent with a tension headache. That's what I get nowadays. It's described as pressure or tightness, often like a band around the head, sometimes spreading into or from the neck. It can be in the back of the head, spreading into or from the neck. A tension headache can be stress-related or associated with musculoskeletal problems in the neck. These usually begin in the teenage years and affect more women than men. Episodic tension-type headaches occur less than 15 days a month. Chronic tension-type headaches can be unremitting and are more disabling than episodic headaches. And then there's migraine or hormonal headaches. They're the second most common type of primary headache. About 30% of adult patients experience migraine-like symptoms, including those with fibromyalgia. according to a 2019 study, but nearly 5 of 10 people with fibro have migraines, and over 8 out of 10 with ME/CFS. In a 2019 study, migraine episodes were over 1.5 times more likely in people with fibromyalgia than the control group who didn't have fibromyalgia. And those with migraine had a higher risk of fibromyalgia. Migraine, in most cases, are episodic. They usually last 4 to 72 hours, accompanied by nausea, vomiting, and/or photophobia, which is an intolerance to light or light sensitivity, and phonophobia, which is where sounds are perceived as loud, distressing, or startling. It is sometimes preceded by a short-lasting aura of unilateral, reversible visual, sensory, or other symptoms. It can be triggered by alcohol and certain foods. Migraines are usually pulsating in quality, one-sided or behind the eye, with a sensitivity to light and sounds and nausea. They can also be aggravated by routine physical activity. Migraine most often begins at puberty and generally affects those aged between 35 and 45 years. It's more common in women, possibly because of hormonal influences. Hormonal headaches are migraines and are due to fluctuations in hormone levels. I can still remember being upset when my doctor said my migraines were hormonal. I was in my late 40s. And to me, that was ridiculous. I understand and better recognize that hormones can significantly affect us. This was the period leading up to menopause. But my first experience, as I mentioned, with migraines was during that first pregnancy. I was in my first trimester, which was most likely due to a reduction in estrogen. I didn't have them again until the experience I just mentioned in my late 40s. The way that estrogen interacts with serotonin is a prime factor in causing hormonal migraine headaches. Symptoms include headache, sensitivity to light, nausea, and vomiting. Cluster headaches are less common, usually 1 in 1,000 adults. They're more painful than tension or migraine headaches. Fortunately, they're relatively brief, minutes to hours, but multiple episodes may be experienced in a day. They can last weeks or months and followed by periods of remission with no headache for months or years. Usually attacks happen at the same time of day, especially at night, and at the same time of year. Symptoms include an extreme, severe, but brief headache, usually around one eye, with tearing and redness of the eye. The nose often runs or is blocked on the affected side, and the eyelid may droop. Most people develop cluster headaches in their 20s or older. Men are more often affected at a 6-to-1 male to female ratio. In a secondary headache, the pain has a sudden onset and is extremely painful. This type is always a result of an underlying illness or trauma that triggers pain-sensitive areas in the head, neck, or face. These are less common, but more serious because additional symptoms often accompany them due to the underlying illness. In fibromyalgia, we often experience sinus headaches that are caused by pressure or congestion in the sinus cavities. They are common, but if they last for longer than a week and are associated with fever, it could be a bacterial sinus infection. I've done a few videos on sinusitis and fibromyalgia, but to break it down here, It's a state of inflammation of the sinuses and nasal passages. There's often a reduced sense of taste or smell and nasal congestion or drainage. There's often ear pain, sore throat, nausea, bad breath or irritability, along with pressure and pain by the eyes and bridge of the nose as symptoms. Eye redness, tearing, and eyelid swelling is common. Symptoms can be on one side or both sides of the face. Sometimes this becomes a chronic condition. When it's chronic, extreme fatigue is also a symptom, and other symptoms are more severe. These are the risk factors for developing chronic sinusitis. I found it interesting that only 3 to 5% of people diagnosed with sinus headaches actually have sinus headaches. Instead, they actually have a migraine or tension headache. So a sinus headache is accompanied by thick, discolored nasal discharge, whereas a migraine is often accompanied by nausea and sensitivity to sound and light. And a tension headache is feelings of discomfort in the head, scalp, jaw, or neck, usually on both sides of the head. So, what can you do? In fibromyalgia patients, medications are first line treatments, but also help with headache pain, such as amitriptyline, duloxetine, milnacipran, and pregabalin. But these don't always help, so doctors may also prescribe other medications. According to healthline.com, preventative medications include blood pressure medications, antidepressants, anti-seizure medications, Botox, and CGRP blocking medications. Acute migraine episode medications include acetaminophen or Tylenol, nonsteroidal anti-inflammatory drugs or NSAIDs, triptans, and usually a combination of medications are needed. Other options can include diet changes because certain foods or drinks can trigger headaches. Keeping a food diary and identifying food triggers can help reduce the frequency of attacks. While exercise is generally beneficial to one's health, it can be tricky when you have fibromyalgia or ME/CFS, so be sure you're not making things worse by overdoing it. Yoga and Tai Chi are good activities. Acupuncture is often used for reducing pain. Stress reduction techniques like learning to manage your stress can help, especially since stress is a major trigger for headaches and migraines. Treatment options for tension headaches include hot or cold compresses, relaxation techniques, therapeutic massages, and over-the-counter medications. I know I enjoy therapeutic massage, but mindfulness and certain supplements like magnesium can help with hormonal headaches. However, researchers are still exploring how effective these approaches can be for these conditions. So I hope you learned something. Please share your experiences about your type of headaches. I send you gentle hugs and support. Love you.